Hello and welcome. My name is Dr. Jason Beyer. I'm a psychologist here at the Indianapolis VA, part of the training program here. I want to welcome you all to Indianapolis and welcome you to our program. I think we have a really great internship here with many great rotations and many talented clinicians. I'm a little bit biased because I work in the mental health clinic rotation. I also think that we are great and offer a really good learning opportunity for you, but you really can't go wrong with any of our rotations. As I mentioned, I'm a psychologist. I work in our mental health clinic, and I'll give you a little bit of an idea of what to expect here. Also, I'll speak briefly about my supervision style and what you can expect, and then some of the goals I would have for you if you were to place here and be on this rotation. We are a very busy, very large hospital, part of the VA system. So we serve many different veterans with many different conditions, problems, and just the kind of the whole gambit of mental health presentations, from anxiety disorders, different mood disorders, many different types of trauma, characterological issues, different personality disorders, kind of you name it, we experience it and treat it here in the mental health clinic. You're going to receive a very well-rounded education here on this rotation. As I mentioned, there's just the whole breadth of mental health conditions here that we treat. A large part of your work would be treating veterans one-on-one, providing individual therapy to the veterans. If you have an interest in group therapy, we have many different types of groups that we run here in our clinic that you can become involved in. Even if I supervise you, you're welcome to connect with other professionals, other psychologists, other clinicians in our clinic. You know, for example, we have a women's processing group that's run by one of our psychologists. That'd be an opportunity if you want to connect there. But we just have a wide variety of groups that we run here in our clinic. So that I see that as a strength of our rotation. For myself, I run an ACT group, acceptance and commitment therapy group. I also run a beginner's mindfulness group. I have a real strong interest in my passion areas in mindfulness interventions. And if that's an interest of yours, there are many ways to connect there. We also have a dialectical behavioral therapy program, which not a whole lot of other VAs have. So that's an opportunity too, if you want to become involved in that program. An emphasis of our clinic, and I'll just say this, we're more recovery. We use a recovery model of care. And as part of that, we have episodes of care. So typically we'll treat veterans for about 12 to 15 sessions, therapy sessions. If they need a little bit longer than that, we could, but therapy is more briefer in nature. And we have a strong interest in using evidence-based therapy approaches. For example, CBT for depression, ACT therapy for depression or anxiety, different types of trauma therapies such as CPT or PE, prolonged exposure. So that would be another strength of our rotation, is you get more experience providing those types of therapies. So in the end, you'll receive a well-rounded experience here in the mental health clinic, but we also have the opportunity to individualize your training needs here on this rotation. I'll give you a brief example. We had a recent trainee who had a strong interest in more crisis interventions or crisis management. And so she was able to shadow our ER department and shadow mental health professionals that work in our ER. And that's a valuable experience for her. So my goals for you would be to become a more well-rounded clinician in the end. But again, we can also specialize and individualize your training based on your interest as well. In terms of my style for supervision, I'll characterize myself as more developmental, mixing in a little integrative approaches depending on the needs of the trainee. So that's a bit about our rotation. I'm sure I'll get the opportunity to interview a few of you. If anybody has any further questions, I'll be happy to speak more about our clinic and what we do and what you'd expect to find on this rotation. I'm wishing you all well on this interview season. Take care.